What do you know about the coronavirus? Where are you getting your information? Can you trust what you hear and see? As countries race to contain the spread and socio-economic impact of COVID-19, the World Health Organization warns of a second contagion: false information. Is it spreading as fast as the virus itself? Hello and welcome to Our Voices. I'm Heidi Adams-Fitzpatrick. This week we look at the importance of truth and the danger of lies in a pandemic. In the next half hour, we'll help you spot the difference between rumor and reality, and we'll also look at what's being done to ensure the information you're getting is factual, accurate, and actually serving you well. We've got a full show lined up for you. To kick things off, here are Oriana Itangishaka and Ayen Bio.
Hello everyone, we're going to look at information which is appropriate for children. How do we talk to them about what is going on? Well, we've got an expert with some great tips for families.
Hi Heidi, well I hope you're ready to dance because I'm going to share an anti-coronavirus song from Kenya with a beat that's going to make you want to get up and lyrics that just might save a life. And this is part of a segment featuring musicians and artists who are using their platforms to disseminate life-saving information.
Thank you, Ayen and Oriane. And you can also join the conversation. Find us on social media. Our handle is at VOA Our Voices, and that is our WhatsApp number right there on your screen. Tell us how this pandemic is affecting your life and what kind of information you would like to see more of. Now, more people at home means more people online looking for information about COVID-19. For millions across Africa, the internet is now their primary source of entertainment, news, and information. And that is where the media come in. Salim Solomon looks at how the news is being covered and in some cases covered up.
What we're learning about misinformation in the wake of a global pandemic is that it can be as deadly as the virus and spread just as quickly. Let me break down what I mean by that. Part of the reason why a gap was created for misinformation to flourish is because of lack of access to information. And basically, across the African continent, journalists are dealing with dispelling myths, resistance from hostile governments, and protecting their own personal safety. Azarrah Karrim, a journalist with South Africa's News 24, was out taking photos on the first day of the national lockdown. She found herself running for her life as police fired rubber bullets at her, thinking she was violating the stay-at-home order.
Behind me were these shots, these like repeated shots. And I stopped in the restaurant and I turned around and I put my hands up and I held my press card in one hand and I started screaming as loud as I could that I was part of the media.
Karrim and other South African reporters are facing controls on access to information. South Africa has criminalized the publication of any statement made, and I quote here, with the intention to deceive any person about COVID-19. This broad language has reporters worried.
We've been trying to counteract this by publicly stating that this is fake news and having like a specific platform to say, like, if you're not sure about something being true or not, send it in here, and then we can determine if it's true or false. And that's been going quite well.
And Angela Quinto, a program coordinator at the Committee to Protect Journalists, says this is not an isolated incident. In many parts of the continent, the military has been called into action to enforce quarantine and are not really used to maintaining public order or even dealing with the press.
We find time and time again on a daily basis, we've been swamped with reports of either journalists being arrested, journalists being harassed, photographs being deleted.
These clashes are occurring continent-wide. Reporters Without Borders has documented members of the media assaulted and detained while covering coronavirus in the DRC, Senegal, Uganda, Nigeria, and other parts of the continent. So one reporter who knows these dangers all too well is Mefo Takambou, a print and broadcast journalist from Cameroon who spent 4 days in prison in 2018. She said African countries need journalists out in the field now more than ever.
If most of them are behind bars, who is going to tell that story? The place of the journalist is on the field, telling the story, keeping people informed.
Given these challenges and how quickly misinformation can spread, readers should always apply their critical thinking when consuming information about the virus.
Salim Solomon there for us. Thank you very much. Now, there is a lot of news and information to consume. So we hit the streets of Lagos, Nigeria, and asked people there what kind of news they're getting and where they're getting it from.
I get my information on COVID-19 through social media, national TV and Facebook, then some social WhatsApp group. Then on social services, more isolation centers should be provided. The palliative government is providing, they should provide more for the people to benefit.
There are different sources where I get my information, like the social media, radio, television and newspaper, and also from friends and relatives, and also from Nigerian Center for Disease Control.
I'm not convinced about this COVID-19, that COVID-19 exists in Africa. Why? Because we haven't seen the proof. So what I'm trying to say is that if the government will try to fight against the COVID-19, all what we need from from the information is to prove 1 or 2 people that have died against the COVID-19. Yes, that is the question I want to know.
I get information from the right source, like the NTA, the channels, the Radio Nigeria, even Voice of Nigeria. I have so many information, even through our mobile apps. I get information. So as I get home, or when I can go anywhere and I came back, I have to educate my family about how they will protect themselves and all things about that.
Now, as we all try to practice social distancing, for many, social media is one of the safest ways to connect with family and friends. But how safe are you on social media? You may have seen all the money scams, the bogus remedies, the fake job ads, all meant to con and mislead people. But could you be sharing false information without even knowing it? And what are social media platforms like Facebook, YouTube, WhatsApp and Twitter doing to help stop the spread of misinformation? Tatenda Gumbo explains.
Hey Haiti, as you mentioned in these past few months, as the COVID-19 pandemic became more of a reality for millions across the globe, another reality became clear: the need for information. From chain messages shared on WhatsApp to videos uploaded onto Facebook, platforms that are part of our everyday lives became the vehicle for some of this misinformation. So it seems right that pressure has mounted for platforms such as Facebook, Twitter, WhatsApp, and search platforms like Google to roll out measures to counter misinformation from spreading. Let's start here. What are the different types of misinformation? According to public knowledge, the most misinformation revolves around 3 themes: the potential cures, factors that contribute to disease transmission, and conspiracies about the root cause of the disease. Well, what measures are platforms taking to combat the spread of misinformation? Let's take a look at Twitter. The platform announced this month that users will now see labels and warning messages on some tweets with disputed or misleading information about COVID-19. Facebook has taken a similar approach, leaving the user to decide if they want to share content that has been flagged as harmful misinformation. The user will see a fact panel as the one on your screen, prompting them to access related fact-check information from Facebook. We all know the popular messenger WhatsApp and the never-ending chain messages shared by users. Well, that's changed. Last month, WhatsApp limited the number of times a message can be forwarded on the platform to 5. The limit isn't set only for coronavirus-related material, but any messages forwarded between users. However, knowing WhatsApp is a powerful tool in spreading information, let's look at chatbots. The World Health Organization launched the WHO Health Alert on WhatsApp. A quick message of "Hi" will get you WHO-vetted information about COVID-19. Here's a newer bot from the International Fact-Checking Network. IFCN has over 5,000 fact checks about COVID-19 compiled from fact-checking networks in over 70 countries. And the popular video sharing platform YouTube has not been exempt from misinformation. With users able to curate and upload their own content, misinformation can easily find its way to millions across the globe. YouTube has committed to pulling material that violates policies related to the spread of medical misinformation. They also include fact-checking information panels on videos with coronavirus-related material. At a time when millions are uncertain about this novel coronavirus, experts say it is understandable why some will access and share misinformation. However, there is clear guidance from many organizations and efforts from these platforms to help people access fact-checked information.
Well, now you know. Tatenda, Gumbo, thank you very much. We're going to take a break here, and when we come back, we bring in Africa's very own fact-checkers. They are the real deal, I promise. We're also going to show you how a few creative minds are helping to stop the spread of misinformation with a good beat and a can of spray paint. Back in a moment. Being part of Our Voices is about more than just sitting here and talking about women's issues. It's about listening to them
and bringing their opinions to the table and making sure their voices are heard.
Because our lived experiences, our stories, and our voices will help shape the next generation.
Yo, with Our Voices, welcome back. We're talking about COVID-19 and all the fake news and false information doing the rounds these days. So I reached out to the folks at Africa Check. They're an independent fact-checking organization, and they say it's their job to raise the quality of the information you're getting. So I spoke to Africa Check's Grace Gichui, and I asked her what kind of information is doing the rounds these days and how you can verify the information you're seeing.
So when something starts trending on Twitter or Facebook or even on WhatsApp, people will just share it without giving it much thought. The older generation is spreading a lot of false information on WhatsApp. Let me say what somebody would do to check if at all what you've seen online is credible or not. You just first search it on Google and you will find if it's credible or not, depending on where it has actually been published. Is it a website that is notorious for fake news? Some websites actually have a disclaimer saying what has been published here is fiction, it is satire, it's satirical. So if you take it seriously and just share it, you'll be sharing false news, but actually the website gave a disclaimer. Another thing people should look out for is miscaptioned photos. Right now we have a lot of photos going around. For example, there's one about bodies, a very graphic video of dead bodies washing up ashore. And the claim on that video was that governments were throwing dead bodies of COVID-19 victims into the ocean once they passed on. But that was not true. These were actually African immigrants who died as they were trying to migrate from their home country. Also, when it comes to images, it's very simple. You can just do a reverse image search. We use RevEye. Then when you right click on the photo, you can reverse image search and you'll see the origin of the photo.
Now, Gichui says she's impressed with the Kenyan government and how they're sending people information about COVID-19. But she says she's also seeing a few worrying trends.
The other thing we should look out for is false home remedies. People keep saying that if you inhale steam, you will get cured from coronavirus, but that is not true. Others that worry me a lot is the fact that leaders don't understand that they're in a very influential position in that whatever they say, people will take it seriously and run with it as a truth. They tend to downplay the risks posed by COVID-19, and eventually it will cause real harm, and people who exhibit the symptoms of COVID-19 will definitely not go to hospital because they think they can treat it at home. Speaking in the case of Kenya, the Ministry of Health, we always have press briefings every afternoon, giving an update of the cases that we have as at now. And they also allow time for journalists to actually ask questions pertaining to the COVID-19 pandemic. The government is also sending text messages to our phones as a nation. Everyone gets a message weekly, either telling us what to look out for, how to know whether you're infected or not, and what to do in case you're infected. I know I can call 719 or dial *719# and I'll get the necessary help. Yes.
Grace Gichui speaking to me from Kenya. Now, the folks at Africa Check were kind enough to share with us 5 things you should remember before pressing send. Take a look.
Here are Africa Check's 5 questions to ask before forwarding a message. Number 5, who wrote it? Many fake messages, especially forwarded ones, don't say who wrote the message. If you aren't sure who wrote the message or where its claims come from, be careful. Number 4, can I verify the claims? Many fake messages don't give sources for their claims or use unreliable sources like hoax news sites. Ask the sender if the same claim has been reported on any trusted news sites or other sources, and make sure these aren't hoax sites.
Trust but verify.
Number 3, does the info make me scared or angry? Fake messages might try to make us scared or angry about something. Before you share, ask yourself if the message is playing on your fears or prejudices. Number 2, does it include shocking pictures, video or audio? Many fake messages use pictures, video or audio to trick us. These could be edited to be misleading. They could also be taken from a different event in another time or place. And lastly, number 1, am I sure this is not a hoax? Don't share information unless you are absolutely sure it's true. Just because it's on a website or social media doesn't mean it's true. You can also search the claims on reliable news sites or fact-checking websites.
Oh, she's both entertaining and correct. Well, a group of artists in Kenya say if you want to stop misinformation, don't stop the music. And some have found that the best way to say it is to spray it. Ayenbio has more.
The music is catchy. You might even say it's infectious. But the artists behind this song say it was written to fight a deadly virus that is far more contagious.
We really wanted to make sure that people get to understand the message about coronavirus. And also what we were trying mostly was to localize the message, because by that time most of the messages that were coming out were messages from WHO and the international body, because by the time we were planning even to do the song, we had not yet reported the first case in Kenya.
Munyiri and the musicians in this music video are part of a fraternity of artists who are using their talent to spread anti-coronavirus messages. And the radio is not the only vessel to send these public service announcements. Just northeast of the capital, in Nairobi's Mathare, a large informal settlement with a population of 500,000, residents can look to the walls, where graffiti artists are doing their part to help stop the spread of the coronavirus.
The idea of graffiti was basically to give people that message right at their doorstep, right at their setting, so that they know how to protect themselves, what is expected of them, and how they can make proactive choices that are going to make sure that COVID-19 does not spread.
This is one of 7 murals painted as part of a light art club initiative to increase awareness on COVID-19. Whether it's a beat you can dance to or a mural you can stare at, the goal is to spread simple messages of washing hands, wearing masks, and the dangers of shaking hands. Munyiri says their song was written and produced by a team of local artists and singers who are recognizable in the community. He says this strategy could help his community understand that COVID-19 is not a foreign issue and should be taken more seriously. But there are limitations in spreading the message among communities, says graffiti art campaign partner Anthony Mwely.
All the resources we use from this campaign, we get them from our own pocket, which is becoming a very big challenge because there are so many places in the slum where we can go and further put the message. I would really urge so many people to come right now and work with us together.
But still, artists continue to paint and sing.
You know, music is very powerful, and basically there is no one person who will ever tell you that they don't listen to music, whatever sort of music they get to listen to.
And that is something most can agree with.
What a great song. Well, still ahead here on Our Voices, how to talk to your children about this pandemic. We have a doctor and a cartoonist in the house to give you the ABCs of keeping your kids calm and collected about COVID-19. That's coming up next. You're with Our Voices, welcome back. Now, it's been said if you want to know the truth, ask a child. But what should you tell your children about COVID-19? Well, we've got some expert advice for you. Oriane Itangishaka has more.
Well, Haiti, we have Dr. Naya Heard-Garris. She's a Chicago-based pediatrician. She's been helping parents cope with this new way of life. She says there are some simple ways parents can ensure their children stay informed and reassured.
Kids are super intelligent. They don't miss a beat. So I think they should know as much as you think they should know as their parents, and trying to be the source of information as a filter. So you get all the information from the news and you filter it and distill it down in a way that they can understand it. But before we even tackle that, we've got to make sure that parents are putting on their own oxygen mask. They've got to make sure that they're taking time for themselves to be their emotional needs, their physical needs, mental health needs, spiritual needs first, so that they can be their best self. Because if you're bringing a lot of anxiety and nervousness, which is all normal, but if you're bringing that to the conversation with your kids, that's just going to heighten up their anxiety and their fear going forward. Sometimes we underestimate what they know and what they've heard. And so you don't want to give them more information than they need. Like, you don't want to introduce fear when they previously didn't have that, but you also don't want to undersell it. They're going to think you're hiding something if you're not completely honest and transparent with them. And you don't know where that mark is until you assess what it is that they already know. For adults, we also are consuming a lot of media, a lot of news. And so for our own sanity, we should probably not watch as much and not engage as much. Same for children. Be sure to not share too much information. Like, you don't need to say what the latest death toll is, or, the new incidence of cases. That's probably too much information.
Dr. Heard-Garris says one way to ease your child's fear and concern is to be honest about your own.
Yeah, we're getting a lot of questions from parents about how do I show strength with my kids when I'm so fearful and I'm so nervous and I'm so anxious. And to be honest, I think right now is the best time to actually show vulnerability and show that, it is not only affecting you as my child, it affects me too. And here's what I'm thinking and here's what I'm doing. Because kids are like, you seem to be doing fine, but I can't see my friends and I can't do these things, and they're having trouble and they don't see you struggling. So I think it's a time to have an honest conversation about that too. And I think the last question I get is, how do I keep these kids engaged? I'm working, or I'm trying to homeschool. I've got 3 other kids. Like, how do I manage it all? And honestly, I don't know. I'm struggling too. I'm in there in the trenches with them, trying to homeschool and trying to do all these things. I think the best thing you can do is to do your best and realize, your same level of productivity, the same level of engagement your kids had at school is not going to be happening now. It is a new normal, and to readjust your expectations, lower your bar. This is not the time to let those perfectionist tendencies ramp up. Lower the bar and get through it. And then just offering some optimism, creating a list of the things that you want to do after COVID. We want to go to the movies. We want to go for, more runs together, whatever it is, creating some hope for once we make it through, which we will.
Dr. Heard-Garris says there is no real playbook for parents, yet all we can do is trust our instincts and take each day as it comes.
That is some sound advice there. Oriane Itangishaka, thank you very much. Now, if like me, you are looking for a bit of extra help when it comes to having that talk with your kids about coronavirus, one Nigerian animator might have just the thing for you. This is the story of Habib and the big green monster out on the street. And as Salim Solomon explains, it has kids running for the soap.
Educating children about something as complicated and frightening as the coronavirus is not easy. Nigerian filmmaker Niyi Akimolayan decided to use the universal symbol of a big green cartoon monster with sharp teeth.
I'm going to play football with my friends, and there's nothing you can... Silence!
So there was a struggle to try and explain to my 5-year-old what it meant for everyone to be on the lockdown. But beyond that was also to explain to them what the coronavirus was and how to get them washing their hands.
In a 93-second animated video, a young boy named Habib desperately wants to go out to play football. His older sister Funke warns him that because of the virus, playing with his friends is unsafe.
Mommy will be sick, no more jollof rice. Huh? Daddy will be sick, no more going out to see movies.
Oh no, not the movies, no!
An uncertain Habib peeks out through the door to see a giant green coronavirus-shaped monster roaring.
Yes, you are.
See for yourself.
He slams the door, screaming.
Okay, it's real! It's real! What should we do?
The coronavirus is out there.
Mwely is the founder and creative director of Anthill Studios. He says he has collaborated with friends and co-workers on an animated project during the lockdown. In addition to the original 4 languages, English, Yoruba, Hausa, and Igbo, it has been translated into French, Swahili, and Portuguese. It aired in Nigeria and around the globe.
I know it's for children, but I've watched it about 10 times. Thank you for watching our show this week. If you are looking for fair, accurate and balanced news, do visit the VOA website. And you can also connect with the Our Voices team on social media. Thank you so much to all the voices who helped make our show happen this week. Now, there is a side to our team that you don't always get to see, and so this week you're in for a treat. Here is Our Voices behind the scenes. From our homes to your home, until next time, take good care. Goodbye.
That violates policies related to the spread of medical misinformation. I got it. I need to take that one off.
Dr. Heard-Garris is a Chicago-based pediatrician. About your own feelings. Did I get that right? Oh, okay.
Let me break down what I mean by that.